Hello people!
Hello!
Welcome to this video. Kai just had his first surgery here in Canada. It was a nasal one and he will share his experience with you.
I had a nasal polyp on my right nostril, and for those that know about that, it's super challenging to live with that, especially not only for you, but those that live with you, right?
Yes, definitely.
How was it? How did we handle it? Did we need to pay for anything? And overall, how is my recovery going? This and a lot more you'll know on this video.
Starting from the beginning, the first day, the surgery day, how was it? We arrived at the hospital and what happened? It was like similar to Brazil. We will try to compare a little bit here and there with the experience we had before, because Kai had a similar surgery before, so we will compare how was in Brazil, where we are from, and how was our experience here in Canada.
And then you can let us know if it is similar where you live or not, or if you had a similar experience as well here in Canada. So first of all, we arrived at the hospital. Like to get there, we just took a bus, so no thing. But once we got there, we pretty much just had to head to the admission center and then give our documents. So pretty much standard, I would say. And after having a look at all the documents, they pretty much just registered us and said that they would call us into another special room as soon as everything was ready. But before that, we kind of just had to speak a little bit and show them that we were actually ready for the procedure.
In Brazil, we usually go, first of all, to a room or to an apartment, even though you're not staying overnight, but you stay in this special room and then you go for the surgery. Here in Canada was different, right? We were to this special location, but it was like the pre-operational area, actually.
Yeah.
We had lots of people in the waiting room. And yeah, Kai just went from there to the operation room. No waiting area or bedroom or something special, let's say. It was just like a big room, and from there, straight to the operation.
Yeah. Another thing that's interesting about that room is that even though it had the little cubicles for everyone, and you had some kind of privacy, not every cubicle had a bed.
Yeah.
Ours actually had a kind of like a daddy chair, and I just sat on it and was pretty much just waiting for me to be called by a doctor or all of the other people that came in to talk with me.
Little details were different, right?
Yeah.
So, for example, when you were waiting there, Kyle changed it in this place, and they asked him to stay with his shoes on. You just put a protection over your shoes, right?
Yeah, like a net guard over my shoes. That's super awkward.
Yeah.
And I don't know exactly why. I mean, I reckon it makes sense for you to have your shoes because you're comfortable and you'll be walking, but still, I don't know, it's weird. But yeah. So as I was waiting, like I said, we didn't have a bed on my little cubicle, so I pretty much waited seated. Prila was seated right next to me, and I was just talking with her, and then every now and again someone would come in.
Nurse and
nurses, the anesthesia doctor, and people even the actual doctor that would perform the surgery. They would just come in, talk to me a little bit, and then come out, and we would pretty much just wait a little bit more.
It was interesting to see how the doctor played a different role here in Canada. Not that's so different from Brazil, of course, the surgeon do the surgery, but not only that, he's responsible for the paperwork that Kai would handle to his work. What else?
Calling as well,
yeah.
Which was quite surprising. I don't know how it is in your country or anywhere else that you live, or maybe even it was something from our experience. But the actual doctor, that was the same doctor that's my specialist that was handling my case, was the same one that performed the surgery, and he was the same one that actually called Prila once the surgery was done.
And he explained me every single detail of his surgery. He was yeah, we did this and we didn't have to do that, and it was like this. When I opened it, I saw this, and I was okay. For him, maybe it's something, it's a common language, right? It's the language he uses every day, every hour. We saw him proceeding a surgery 2 or 3 before us. So when we were waiting, he was talking to families and saying, oh, we're going out to do the surgery, it will be like this, it will be like that. And we saw him coming back later on to tell people how was the surgery. And because we had to wait, I don't know, for 2 or 3 hours before the surgery, so we were there doing nothing, just waiting. And then we saw everything happening. And he called me. When he called me, it was in Brazil, the surgeon never ever would call or do the paperwork, because he was oh, you need 7 days to rest at home, and you need this, I will provide you the documents. And I was what? The doctor provides the documents? In Brazil, I don't know who, but I know that's a nurse or someone from
usually there's an
management
assistant that will handle everything, and he only gives the final word or the actual signing of the document.
Yeah, but it's different here, right?
Yeah, a thing that's quite different here from Brazil, and even like from the UK as well, when we were there as well. And even in Germany, actually. It was so different.
Different from every place we have ever been.
Yeah, sorry about that. So basically it was different from everywhere that we lived. When the doctor gives you a prescription, that prescription goes directly to the pharmacy that you are registered to. You can change the registration, because I already did that actually like not so long ago. But basically you are registered to one pharmacy, and once your doctor gives you the prescription, that prescription will go directly to that pharmacy. So the pharmacy knows about all of the medication that you are taking from every doctor that you are taking.
So you just, for example, after the surgery, he came home, of course, and I left him here after he ate and everything else. And I went to the pharmacy with his health card, and I said, my husband just had the surgery, check on his wife, and they checked there. And when they opened the system, they saw the medicine he had to take, and they checked with the paper the doctor gave to, see if they matched. And yeah, it was there. We were like, so interesting.
Yeah.
Huh?
Yeah. In the other countries that we lived, usually you go to any pharmacy with the prescription. The prescription will be signed and everything else. And then you can pretty much just show the prescription, and the pharmacy will see if they have the medication and then give it to you, just like that. Another thing that's quite different is that the actual operation room and also the waiting room that we were before, they weren't cold.
Yeah, in Brazil, they're like freezing. There is a saying that's because of bacteria. When the temperatures are low, you can, prevent kind of the accumulation of bacteria in the air or viruses or whatever. But here, it was pretty warm.
Yeah.
We were like sweating. And we're like, not because we were nervous, but it was hot.
Yeah.
And on the other note, we saw that in Brazil, we usually have like a pre-operatory exams. And here, at least for the surgery, you didn't have any, right?
No, usually, like Prila said, we have preparatory exams, and those exams will be like stuff like radiography, blood tests, all around, and right next to the actual surgery, like one day before or on the day of the surgery. And for this surgery that I did, the only thing that they did was a CT scan of my face. And that was pretty much just to check if I really needed to have the surgery and how it would be done. One thing that stood out while we were in the hospital is that even though everybody's using those
uniforms,
those uniforms, like those blue uniforms that you see, like the scrubs, they call it scrubs. You could see that some of them were dirty, and you could also see that some of them seemed to be used all week long. Like they weren't ironed at all. They were like completely mushed.
But not only the uniforms, like the appearance as well. Like some people that passed by, we knew that worked at the hospital because they had the blue uniform. But like they didn't look like they were wearing, I don't know, Crocs, but like their hair were messy, their face, they were like, Yeah. And in Brazil or other countries we saw, people like nurses and doctors and who works in that environment, they usually have like a certain appearance, they're like, well, how can I say this?
They look like well fit, basically. They will be looking like they could go to a gala.
They have an organized appearance.
Yeah.
And here, when you look to, people that work in the hospital,
you could tell that they were working for long hours and they were tired.
Yeah. Maybe. But maybe something just for this hospital or something that we noticed that it was only this day. I don't know, we're not like judging, we're just commenting things that we see that were different in our opinion. And if you have this question in your head, this surgery Kyle did took like 30 or 40 minutes, and then the doctor called me. And there is an interesting story about the anesthesia that Kyle can share with you later on. But I want to stress here that he went home at the same day. We waited for the surgery around 1 hour, and then he went to the recovery room. He stayed there for 2 more hours. So in 3 or 4 hours in the hospital, like after the surgery, we were back home. So it was the same day to start discharge, and he had a week off his work, so he could rest and recover. But in general, Kyle, what do you think about the surgery, the hospital? What's your opinion?
I mean, the surgery in itself, it was simple. At least in my case, like every case is different, of course. Yeah. And I had a similar surgery not so long ago, some 5-7 years ago. And that first surgery was way more complicated. I was feeling pain after the surgery. I think it took me longer to actually arrive home. I had to spend more time at the hospital. But for this one, it was quite simple. Like Prila just said, the whole procedure was all done in less than 4 hours, and they spent more time waiting, not only to start the surgery, but then for me to recover from the anesthetics. I mean, it was quite simple. And the hospital in itself, it was quite good. Like, we saw that everything was in place, everything was organized, everything was clean. People knew where to go, and they also shared like this sense of like confidence. Also, always trying to let you know that around them you are going to be comfortable, that they care about your needs, they care about how you are feeling, especially when we're seeing like little kids, right? There were like some little kids that were doing similar surgeries, and the doctors were simply amazing with them.
Did we have to pay for it? Did we? Did we? Did we?
Not a dime.
Woo,
That might be surprising for our fellow Americans, but here in Canada, as you know, we're paying taxes, and all the taxes they already covered for the health insurance, so we didn't pay for anything at all. The only thing that came out of our pocket was for the actual prescription, and most of it will be covered by the insurance from my workplace.
Yeah, and we praise the Lord because of this, because as immigrants, we arrived 9 months ago. If you watch it, the previous video, I said the same thing, but like it's something I will repeat for the rest of my life, right? It was suffering, as we mentioned in the beginning of the video. It wasn't easy to live with, you know, your nose clogged, and now he's breathing better, still recovering. We are recording this video right after his surgery. I think we had it 3 days ago, so it's still a process, right? He has lots of mucus, you know, he's still in the process of healing, but
still a little bit of blood here and there.
Yeah, but still, like 9 months ago, we landed here in Canada, and now we have had a surgery. This is like amazing, guys, and we are very thankful, very grateful. Talking about like this recover, this mat, how has been this process? How has been like your daily routine now? Cleaning your nose or not, or doing the mustache protector or not?
Yeah, I mean, it has been easy. Like I said before, I thought it would be a little bit harder, but no, it has been quite easy. I am taking it slow though, because I know that even though I'm feeling well, I can't really like get over my head and start to do lots of things, because I will start to feel pain because of that, and might even bleed a little bit. But yeah, it has been easy. Like I have been waking up at almost the same time that I wake up normally. Sometimes I do wake up a little bit tired, but I reckon it's just the first few days, so maybe the next few days will be easier. And throughout the day, like I'm not feeling pain at all. I start to feel a little bit of discomfort here and there just before I need to take the medicine, because my medicines are by hour. I had to take an antibiotic and also like some pain meds. And when it's like 1 hour, 1 hour and a half before I need to take the medication, I start to feel a little bit. It's not really pain, it's more like a discomfort, like a pressure around my nose area and also my cheekbones. And then after like some minutes it goes away, and then it comes back. Sometimes it's stronger, sometimes it's weaker, but it's completely manageable. And as soon as I take the medicine, like some 20 to 30 minutes after, I'm completely fine. And throughout the day, I have been able to eat alone. When Prila is at work, I am able to eat alone. I'm able to like go around the house, do all the things that I need to do. Of course, I'm not lifting any weight, I'm not doing anything that's in excess. But yeah, it has been easy. One of the things that I also need to do in this period that I'm recovering is that I need to clean my nose. But I can't blow it, which is, I mean, if you do this surgery, you know what I'm trying to say. Like, you really feel like you need to blow it because you feel so much stuff in your nose, but you can't do it. You can only either pull it or actually clean it. And to clean it, I have like some saline solution that they also gave me as a prescription. And there is like this little teapot thing that Prila bought me, and you kind of like just grab it, put it on one of your nostrils, tilt your head a little bit, and then all of the solution will come out from the other nostril. Yeah, it's a bit yuck, but believe me, it's not that gross. And while I'm cleaning it, it doesn't come out like that much stuff. Usually it's pretty much clear, like just the clear solution coming out. And then when I start to breathe again, I start to feel that I have stuff on my throat or even like on my nose, and then I can actually just like pull it and then throw it through my mouth.
But how are you feeling right now? You feel that you can breathe from the nostril that you had the surgery, or not yet?
It's kind of awkward. Like sometimes I can breathe normally. Right now I can actually breathe normally, like through both nostrils. The left one seems a little bit congested right now, which is probably because of the secretion from the right one. But the right one is quite clear at this moment.
And the surgery was on the right side, right?
Yeah, the surgery was on the right side. So throughout like yesterday and the day before, it was super congestion at the right side, so I couldn't breathe that much from it, but the left side was completely fine. Today, the left side is a little bit congestion, the right side is almost fine.
Which means, for the people that are at home,
Which means that things are clearing up, and soon I will be able to breathe normally through both nostrils. As many of you know, once you have a surgery, you do need to have a post-op consultation with your doctor. Because they will need to see if you're recovering well, if they need to change the medication, if they need to do something else, maybe the surgery didn't go as well as they planned, whatever. But you need to have this second consultation. And to do that, I had to actually call them. I called them today, actually, and booked in my consultation for like 2 weeks from now.
Good.
So on the 3rd week after the surgery, I'm having the consultation. I'll be able to talk with the doctor, who will probably like look inside my nose and see how it is scaring, if it is well or if it's not, if it needs to change the medication or not, how I'm handling it, if I'm feeling any pain, and things like that.
This doctor he will see was the same one he saw before the surgery. It was the same one that did the surgery, that called me after the surgery, and he will see him after surgery. It's the same doctor, he does everything, you know. And I remember when he went to the first appointment, I was there, so the doctor went outside to clean the tools he was using. So here, we were impressed, because the doctor was like, you know, cleaning, doing everything, signing paper. So if you are watching us, and if you are a doctor or studying to become a doctor, just be aware that here in Canada, apparently, doctors, they do
get their hands dirty.
Yeah.
This was our experience.
Yeah.
How everything went by, how we are still going. And I mean, we know that it might be different for you. Maybe you already had this surgery before and it was quite different for you. Maybe you felt a lot of pain, but this is how I'm feeling at the moment. And we just want to share this so that people that maybe will do that in the future can be more alleviated and know that it can be an easy process.
And maybe it helped someone that will need to take a surgery here in Canada, the first surgery, right? For us, it was like a bit scary because we didn't know what to expect, and we don't want to have any surgeries anymore, but we can't promise that. Only God knows about it. But the point is, the service here in Canada is excellent, and for us, it was fast, speedy. We arrived here 9 months ago, and we could like do the surgery, and as Kai told you, you just called the doctor and he had the post-surgery thing, which was like, you know, super quick. Thanks so much for watching. I hope this video may have helped you somehow, have maybe increased your hopes. Please keep praying for us, and see you on the next video.
See you.
Bye.